Post-operative instructions, general. The day of surgery. Some degree of discomfort and pain arises as numbness subsides. We recommend beginning the use of the prescribed oral pain medication before the numbness wears off. Please do not drink alcoholic beverages while taking prescription pain medication. Moderate to severe pain usually does not last longer than 24 to 48 hours. Persistent or increasing pain, 4 to 5 days following oral surgery, may be caused by early loss of the blood clot, dry socket, or infection. If you feel this may be happening to you, please contact us so that we can help make you more comfortable. Do not disturb the area of surgery. Avoid vigorous chewing, excessive spitting, or rinsing, as the initial healing may be delayed, active bleeding restarted, or infection introduced. A small amount of bleeding or oozing is to be expected. If excessive bleeding should occur, the following procedures should be done. Gently wipe excess blood from the mouth. Place a clean gauze pad directly over the area that is bleeding and maintain steady, firm biting pressure on the gauze for 30 minutes. If not successful, repeat the procedure with gauze soaked in a strong solution of tea, or bite on a moist tea bag for another 30 minutes. Remain quiet, sit upright, and apply an ice pack to the face. If these measures do not succeed, call the office or the after-hours emergency number. Limit physical activity during the first 24 to 48 hours after surgery. Overexertion may lead to post-operative bleeding and discomfort. When you lie down, keep your head elevated on a pillow. Most patients can resume normal activities in 3 to 4 days. Swelling usually develops during the first 12 to 24 hours following surgery, often increasing on the second and third day. Swelling can be minimized by wearing an ice pack on the side of your face for 30 to 45 minutes every hour while you are awake during the first 24 hours following the surgery. Fluid intake is important. We suggest you start with clear, carbonated beverages such as ginger ale, 7-Up, or Sprite. Once your stomach has settled, you can advance to other fluids such as water, teas, soda, broth, soups, or juices. Also avoid hot liquids until the numbness is worn off and the bleeding has stopped. It is important to drink plenty of fluids. Avoid using a straw for several days, as it may cause the blood clot to dislodge and delay healing. Soft, cool foods that require little or no chewing are most easily tolerated at this time. Eating can prevent nausea, sometimes associated with certain medications. Once your stomach is settled, soups, broiled fish, stewed chicken, mashed potatoes, macaroni and cheese, eggs, and cooked vegetables can be added to your diet as comfort indicates. Ensure Carnation Instant Breakfast and yogurt supply excellent added nutrition. Take any antibiotics we have prescribed on the specific dosing schedule. It is important to take the antibiotics to completion. If you are given antibiotics and take birth control pills, you should be aware that the birth control pills might become ineffective. Therefore, take appropriate precautions for the remainder of your cycle. Take any regularly scheduled medications for diabetes, high blood pressure, etc. on your regular schedule unless advised to do otherwise. Avoid smoking completely, as it tends to slow the healing process and may also contribute to the development of a dry socket. Do not drive an automobile for 24 hours following surgery if you had IV sedation or if you are taking prescription narcotic medication, such as Lortab, Darvocet, or Tylenol No. 3. If you were informed that a sinus communication occurred during surgery, or if you had some surgery that involved work near your sinuses or in your sinuses, please refer to the sinus instructions video. The day following surgery and thereafter. The day after surgery, start rinsing your mouth carefully with a solution made by adding a half teaspoon of salt to a large glass of warm water. Repeat 3 times a day for 1 week. Resume your regular oral hygiene as soon as possible. Make sure to brush gently around the area of the extraction to avoid inflammation in the area. Please do not use a syringe or water pick to aggressively rinse for the first week. Sutures were placed to control bleeding and aid in healing. Typically, they dissolve on their own 3 to 7 days after being placed. If they fall out, they do not have to be replaced. Any swelling, soreness, or stiffness of the jaw muscles can be relieved by applying a warm, moist towel to the affected side of the face several times a day. Moist heat should be used after the first 24 hours. If swelling, tenderness, or pain should increase after the first few days, call the office. Bruising marks may appear on the skin of the face or neck during the first few days after surgery. It will disappear after a few days. Moist heat application will help relieve this condition.